Hi and welcome. This is Alan from worldacupuncture.com. I'd like to bring you up to speed a little bit on our latest video release for members of World Acupuncture. In this video I discuss at the recent Bridging the Gap between TCM and Japanese acupuncture workshop held in Brisbane. Discuss the root treatment, a kidney root treatment utilising the point lung 5 and kidney 7. I talk about breathing during the course of the root treatment, how to focus and what to do with your hands. I also explain a little about the energetics and the power behind the root treatment, and there's a demonstration of the active location of kidney 7, and I also give a few guidelines on selecting needle depth and, most importantly, how to handle the guilt over poor results when we don't achieve the outcome that we're looking for in treatment. The subject of this video, however, is a question asked by Chris on the World Acupuncture Forum regarding the use of kidney 7. Chris asks, why do we use kidney 7 for a yin deficient patient as opposed to kidney 3? Theoretically, from the text that Chris is referring to, the statement is made that kidney 7 tonifies the yang qi strongly. I'm not sure of the source of this particular statement, however we'll talk a little bit more about how that could be possible as well. In the text that Chris is referring to, he also states that the text refers to kidney 3 in regards tonifying the yin qi. Chris understands that the earth point in this case will nourish the yang aspect. We're talking about kidney 3 here, of course, but from experience of using kidney 3, it seems to be very effective in drawing heat down from the chest and upper burner. This being said, I always use lung 5 and kidney 7 as part of the kidney root treatment. However, does this tonify the yin aspect? I understand that lung 5 sends cooling energy down to the kidneys, being the water point, but wouldn't kidney 3 work better to help this root treatment? Even though it confuses me, I've been using kidney 7 to great benefit in the treatment of yin deficiency. Does the metal aspect of kidney 7 have a job of circulating the moisture sent down by the lung? Chris also states any help would be greatly appreciated. Every loose end I tie up pours more petrol on my intention, and I believe the effectiveness of treatment outcome. Great question, Chris, and I'll do my best to answer it for you. Firstly and primarily, using the classical parent-child relationship in the 5-element theory of acupuncture, kidney 7 is the nominated point for tonifying the kidney qi. Being the metal point, it is the preceding point to the water element. So therefore in the classical sense, we would use lung 8, kidney 7. However, lung 5 has proven to me to be very effective in as much as it is the water point and the representative of the kidney on the lung meridian. Having said that, kidney 3 is the source point or the earth point of the kidney meridian. From this perspective, it is the representative of the spleen meridian on the kidney meridian and is exceptionally good at tonifying the source qi of the kidney meridian. Now, it is possible to vary the points on the kidney meridian that we use in the root treatment. For instance, if I have a situation that there is an extraordinary amount of deficient heat disturbing the equilibrium of the patient, or the contractile quality of the kidney meridian is deficient, I will often choose to use kidney 10 instead of kidney 7. The kidney 10 being the water point on the meridian, on the kidney meridian, it has got the quality of being able to contract and hold. It's a very important point. I use it a lot in situations where there has been a prolapse of the intervertebral disc in the lower back, or intervertebral disc really anywhere. However, back to the question, kidney 7 indeed is the metal point. and is very effective at increasing the circulation of the kidney yin qi in the body. It works beautifully and in harmony with the point lung 5. Kidney 3 I find more explicitly beneficial in yang deficient patients where both the yin and the yang qi of the kidney is deficient. Now, the effectiveness and the specificness of the use of any of these points is very dependent on the needling depth that we use on any of the points, kidney 10, kidney 7 or kidney 3. Hence, if we were treating a yang deficient patient using the point kidney 3, we would be much more inclined to use a very superficial insertion, in some occasions contact needling alone. With kidney 7, again we can vary the depth according to the amount of yin qi that we want to tonify. Hence, if we were to do just very superficial insertion on the point kidney 7, then the propensity of that particular treatment would be more around the yang aspect of that particular point. The deeper we needle, within reason, to 2 mil, 3 mil, the more yin qi we're going to pick up with that treatment. We're actually transferring yang qi through the needle to either the yang or the yin level of that particular point. This is also the case in point for kidney 10. Again, the inclination, because this is a Hossi point, this is a water point, this is in the crevice, and the point itself seems to be located more deeply than either kidney 7 or kidney 3, then the tendency is to needle this point a little deeper. In doing so, we are emphasizing and tonifying the yin aspect of this particular point and the meridian. And the benefit in being able to elicit a contractile quality from the use of this point in the kidney meridian is very marked. Chris, I hope this video answered to your very, very relevant question on the World Acupuncture Forum is satisfactory for you. It helps clarify your use of the points, and to anyone else viewing this video, please, you're very, very welcome to join us at worldacupuncture.com. We are about exploring Japanese acupuncture and actually taking Japanese acupuncture global in the 21st century. Thanks for your time. Great to talk to you again, and I look forward to catching up with you again soon. Cheers.